The shoulder joint is a multi-axial synovial ball and socket joint, which involves articulation between the glenoid cavity of the scapula and the humeral head. This classification of joint allows the shoulder to move 360 degrees. This 360-degree movement allows the human body to throw, push, and pull objects with superior force. Such examples are throwing a baseball, pushing a car, and pulling oneself up a rope. This is all capable because of the two joints that should consist of the glenohumeral joint and the acromion-clavicular joint. Glenoid fossa, acromion, and clavicular coming across the scapula. The glenoid humeral joint is a ball and socket synovial joint that is diarthrotic, meaning freely movable. This joint is formed by the articulation of the curved head of the humerus and the shallow bowl-like depression of the scapula, called the glenoid fossa. Both the head of the humerus and the glenoid cavity of the scapula are covered by hyaline or articular cartilage in here. The second is the acromioclavicular joint, classified as a plane or gliding synovial joint and is diarthrotic in function. This joint is also freely movable. Acromion, clavicular atop, also allows free movement of the shoulder joint. As the name suggests, the AC joint is formed by a junction of the acromion of the scapula and the lateral end of the clavicle. The integration of this joint grants the shoulder some increased flexibility, which would not be possible with only the glenoid humeral joint, as seen here. There are four main muscles that make up the shoulder joint. The subscapularis is a large triangular muscle that inserts into the lesser tubercle of the humerus and the articular capsule of the shoulder. Its main function is to internally rotate the humerus when the shoulder is raised, drawing the shoulder down and forward when extended and preventing displacement of the humerus. Next, we have the supraspinatus. The supraspinatus is a small muscle superior to the spine of the scapula. The supraspinatus originates in the fossa of the scapula and inserts into the greater tubercle of the humerus. The muscle's main function is to abduct the arm at the shoulder. This muscle is a source of shoulder and neck pain because of impingements. This is because when shoulders are pronated or forward, the humeral head protrudes into the articular capsule of the shoulder, causing the muscle to become frayed and torn. The infraspinatus is a thick triangle muscle. This muscle originates in the infraspinatus fossa of the scapula and inserts into the greater tubercle of the humerus. Its main function is to externally rotate the humerus and stabilize the joints. The teres minor is a slim and narrow muscle that originates in the lower lateral border of the scapula and inferior angle. It inserts into the intertubercle groove of the shoulder. Its primary function is external rotation of the shoulder.